Welcome back. Now, this topic that we're about to look into is not a topic that many people will want to talk about, but is a reality that exists in both the developed and developing countries of the world. Cancer has taken precious lives, but there are success stories of survival from the life-threatening medical condition. What makes the difference? October is Breast Cancer Awareness Month, but we'll be looking beyond breast cancer to talk about how we can reduce our risk factors for the common cancers in Nigeria, among other issues. To enlighten us more on this and share story of survival, we have been joined in the studio by a breast cancer survivor and the founder of the Brigham Foundation, Abigail Simon Hart. Thank you so much for being here this morning. And of course, we have a consultant pediatric oncologist from the Lagos University Teaching Hospital, Dr. Edamison Temiye. Thank you so much for being here.
Thank you very much.
And we have a clinical oncologist from the Lagos State University Teaching Hospital, Dr. Molara Fatirigun. Good to have you here.
Thank you.
Okay, let me start with you since you know, a lot has been said about cancer, some facts, some myths, and what really is cancer all about?
Okay, so I'd like to start by saying that cancer actually starts from the cell. I know most of us have, we had biology while we were in, to secondary school. So the cancer actually starts from the cell, and you have these cells that become cancerous and they begin to multiply. So the human body is made up of over trillions of cells. So each one becomes organized. Some form the breast, some form the skin, some form the liver, right? So if a cell in any of these organs become cancerous, it begins to replicate, and then we have breast cancer, we have stomach cancer, we have liver cancer, we have prostate cancer, and the likes. So for cancer, it actually starts cellularly from the cell, and it has a potential of growing large in that organ and begin to spread to other parts of the body. So we grade it in stages, right? So the aim majorly for treating cancer is that we want to first of all prevent it, right? We want to catch it early and prompt and complete treatment, right? And also for people who are survivors, we want to support them, right, and rehabilitate them, because the truth is that cancer patients actually go through a lot. So we need to support them, in the continuum like that. So basically, that's just like an overview of cancer.
Okay, now Dr. Temiye, this might seem very simplistic, but I'm sure people would want to ask you, what are the causes of cancer?
That is the greatest question, and the one the doctor hardly provides the answer. Most cancers, we don't know what causes them. That is the major issue. And the reason is simple from what my colleague has said. Each cell of our body is like, we build a house with block cement. Let's say a piece of block, usually have a regulation. You are dividing 2 times and you stop. Then this block now decides that I'm going to divide 50 times and nobody is going to stop me. And it's because one of the genes inside it has been corrupted. The gene is what controls everything in our body. And it refuses to obey anybody else. It refuses to obey the body and start spreading and destroying what is normal, replacing with itself that is not functioning properly until it terminates the life of the person. Most times we don't know what triggers that thing. There are some few things that we know that, okay, cigarette smoking, when you smoke cigarette, it predisposes to cancer. The word predisposition is used because it's a factor that if 20 people smoke cigarette, maybe 5 of them will develop cancer, whereas those who don't smoke cigarette, maybe 1 of them will develop cancer. That you don't smoke cigarette, that don't mean you cannot develop lung cancer. For example, and I link that to something else. My grandmother died from lung cancer.
She never smoked.
She never smoked, but she cooked with firewood. And it has not been shown that cooking for a long period with firewood could lead, or charcoal or that kind of thing, can lead to cancer also.
Is it like the smoke?
Yeah, the smoke. All those chemicals that come out from the smoke is known to cause cancer. we know that some infections, some germs, like Epstein-Barr virus has been linked to cancer, especially in children, like the human papilloma virus has been linked to cancer. It's not in everybody, but when 100 people have those infections, more of them do have those cancer. There are some that will never develop that cancer. But in most of the other cases, the cancer just comes and we just wonder, where is this cancer coming from? The other thing that as you grow older, and the cell go through the cycle of dividing and repairing, more errors occur. So cancer will occur more in older people than in younger people.
But of course, we've seen a lot of young people, you know, coming down with different cancers. For Nigeria, let's talk about some of those common cancers. We'll come to you. We know breast cancer, prostate cancer, and most of the time when we talk about cancers, we don't look towards the children.
That's true.
So please, quickly, tell us about this and what we can do if there's anything.
Yeah, cancer in children actually is being buried under adult cancer. And those of us taking care of them are actually coming out to say, no, these children also have cancer and they should be taken care of. Most of the cancers in them is not breast, it's blood cancer. Blood cancer is more common in children. And then in Nigeria, we have this cancer we call bucket lymphoma. It's linked to things we use to fight infection. It's quite prevalent in Nigeria. Brain cancer is a major issue also in children, and unfortunately that is one of the most difficult things to treat. I just saw a child who had gone to India and come back. Where the cancer is where we call it the pons. Our pons is at the base of our brain, and that is where we control our breathing without effort, heart, you know, pumping without effort, and that is why that cancer has gone to arise. Nobody is bold enough to go there to operate. So it just been treated with radiotherapy, treated and recall again. Now, cancer in children is not as common. For example, in UK, they say about 0.5% of all cancers occur in children. In Nigeria, it's believed that about 4% of all cancers, 4 out of 100, occur in children. So cancer in children is not as common as in adults, but it do occur. In fact, the greatest shock I've heard of recent is that I used to read about cancer occurring in infants, those are less than 1 year. It took time before I started seeing them. The last 4 years, I started seeing them. In fact, the last one I saw was a 2-week-old with a cancer in the lung.
2 weeks old.
2 weeks old. So, and it's a challenge taking care of them.
And it has nothing to do with what perhaps may have eaten or something.
You were just born, you were just delivered, for God's sake. And what do you say is the cause of that one? They said that once they have become
before we come to you, let me quickly ask Dr. Fachirego. Among the major cancers in Nigeria, of course, is breast cancer.
Yes.
Now, and you doctors always talk about how women should examine their breasts. They should make friends with their breasts so that they can, you know exactly how the breast is, so that if there's anything unusual, they will easily take note of it. Please, can you tell us how we should examine our breasts?
Okay, so for breast self-examination, basically, is that the first thing is you need to know your breast. How does it look like normally, right? So by the time you start seeing a change in size, right, there's one is getting bigger than the other, right, and you see the nipple going inside, you begin to want. So I tell people that once you see anything abnormal, it's better you scream at that point.
And go check it fast.
Please just hold that thought. Okay. We'll be right back after this short break.
All right, then, thank you.